We're happy to have with us James Capretta, who's a fellow of the Economic and Ethics Program of the Ethics and Public Policy Center. He's author of the healthcare policy blog Diagnosis. From 2001-2004, he served as the Bush administration's top budget official for health care, Social Security, pensions, education, and labor policy. He was also the lead person at the OMB for all aspects of Medicare, Medicaid. Can't think of anybody that should know more about it than James Capretta. James, how are you doing?
I'm doing very well. Thank you for having me on.
Thanks for being here. You really got our attention with this this article you did, this piece you did with regard to the Baucus death spiral, and of course you're talking here about insurance companies, basically, aren't you?
I am, yeah. It's a pretty well-known concept. It's happened many times, actually, at the state level already. We've had a lot of experience with these things happening, and it's a pretty well-known phenomenon. And the way the Baucus bill is set up, it pretty clearly would head in exactly that direction.
What is that phenomenon, Jim?
Well, basically, it's a requirement that insurance companies take all comers without regard to their health risk. So people that haven't been insured for a while or perhaps insured in other places can sign up with an insurance company and get the same premium as everybody else.
In other words, they can wait till they get sick.
Well, here's how it'll work. If you require that right up front, and then the way the insurers have said, look, well, we might be able to agree to that, so long as everyone in the country has to have insurance. If everybody's insured, then people won't be able to game the system, so to speak. But the Baucus bill has very low penalties in the early years for people that don't get insured. It's only like $200 for an adult in 2014, phasing up pretty gradually to something like $750 in 2017. Mm-hmm. And meanwhile, right away in 2013, all the insurance companies are going to be required to offer coverage without regard to health status. Mm-hmm. So that means at that point, in theory, there's a requirement for people to get covered, but they don't have to do it. They could just pay the fine instead, and then wait till they get sick, and then sign up with the insurance when they really need it. Meanwhile, the sick who really do need the coverage right away will sign up with the insurance right away, and so the premiums for the people that actually remain insured will go up very dramatically.
Well, that's the bottom line, isn't it? Let me make sure that I and our listeners understand this concept now, because I think it's fundamental to what they're trying to do up there, and that is that the idea is for it to work the way the administration says that it will work is that you'll make these insurance companies take everybody. I said the other day, I don't think it's insurance anymore. I mean, that's not my definition of insurance. But you have to take everybody. You can't discriminate with regard to pre-existing conditions or anything like that. The trade-off is the insurance company says, well, okay, if we have to do that, you have to make sure that everybody is required to come into the system so that we can have a lot of young, healthy people in the system to make up for the maybe older, sicker people that you're making us take. And we'll charge them all, what, basically the same rate?
Yeah, basically the same rate with some adjustments.
And it'll work out, and that'll make it work out for the insurance company, and it'll make it work out for the government, and so forth. But what has happened, and that was the deal the insurance companies made with the administration.
That's correct.
But now what the insurance companies are saying is that, wait a minute now, after this Baucus thing, your penalties on people for not having insurance are not high enough. People are not going to buy it, and they're going to wait until they get sick and come in, and that's going to upset the apple cart, and we can't make any money.
Right. Well, it's probably
worse than that.
It's going to unravel the whole thing. I mean, if you have to take all comers and you know that by definition they're going to be more likely the sicker population, you're going to end up with a situation where the people that are covered are going to get, it's going to become an unhealthy risk pool, as they call it. It's going to drive up the premiums, and that means even more sort of healthy people, or relatively healthy people, will exit.
Well, what is the answer to that? I mean, from a technical standpoint, I guess is a way to put it. Can they just raise the premium on young, healthy people and cause them to raise the penalty on them? And cause them to, for not having insurance, cause them to get insurance, and then everybody's happy?
Well, that's what the insurers are pushing for. I think that's the wrong way to go. I mean, these bills, the fundamental problem with these bills is they're trying to shove, they're desperate to enact something that they can call universal coverage, but they don't want to spend the taxpayer, they're spending a lot of taxpayer money, but to really do that, they'd have to spend even more. And so they have all these hidden fees, mandates, requirements, regulations that try to socialize the costs in different ways instead of just subsidizing people into coverage to try to keep the costs down.
Instead of doing it directly through the government, they're using the insurance companies kind of as their handmaidens.
Absolutely. I think that's coming at the problem exactly wrong, especially because these bills have no real theory in them for how they're going to slow the pace of rising costs. So if you make people buy insurance that's going up at 8 or 9% a year, you're just asking for trouble because you just can't do that. So what I'd recommend is coming at this totally differently. I wouldn't try to go to a mandatory system. I would say that there is an issue for pre-existing conditions. We ought to be able to handle that. There are these pools in the states called high-risk pools. They're poorly run. They're very underfunded. We ought to be funding those and taking care of these folks that way. It can be done. It's just a matter of will and doing it.
Well, what about the assumptions that they're using in order to get to their price tag? They're claiming that this bill now is going to cost out at about $829 billion. Others say that if you really cost it out correctly, over a 10-year period, it's going to cost around $2 trillion. Aren't there certain assumptions that they're using to get that lower number?
Oh, there are. There are a number of them. First, they have the $829 billion number excludes about $225 billion in presumed physician fee cuts that everyone knows can't be sustained. And so, therefore, by definition, you're already, sort of hiding away over a couple $100 billion that really everybody knows has got to go into the bill that they're not counting.
They're claiming cuts that they know that they're not going to achieve.
That's right. Then there's another $100 billion that they're trying to use. They're trying to make the states pay that I don't think will survive the process because the governors don't have the money, and they're just going to say, we don't have it, we can't do this.
Medicaid?
So Medicaid money, exactly. Then there's, then here's a really funny thing, is that they're promising everybody this new entitlement, but to caps on your premiums, but they limit it to only to people that aren't in the employer-based health insurance system. So, they say we're going to promise this to everybody between 100 and 400% of poverty. In the United States, that's a lot of people. It's about 130 million Americans between 100 and 400% of the poverty line under the age of 65. So this is potentially a huge entitlement.
Yeah.
But they're only going to give it to people that are in, that don't get their insurance through their employer, and so they limit it to people that are about 15 to 17 million people. This is not sustainable. You're going to give away this very large and generous entitlement to a subpopulation of that group. Meanwhile, everybody in the employer-based system gets no additional help and has to take the coverage, which they can't often afford.
So guess what's going to happen?
Congress in a couple of years will come back and expand it to everybody. That's the way they always do it.
This is just the framework, isn't it, James?
Exactly right.
This is just the starting point.
Exactly, and this thing is loaded with potential for expansion. You can already see senators lining up to, increase the subsidies, cover this, cover
absolutely,
that.
just like all the other entitlements that we've passed in times past. The thing is just on schedule to be just like that at a time in which we're already going bankrupt. Thank you very, very much for being with us today.